we have Dr. Lori Gerber from My Dr. Lori, Integrative Medicine. And I'm excited to have Lori on tonight because of this topic, peptides. So let's start with big picture. Lori, could you just share with people, like, what are peptides, like in the simplest terms, like, and how do they work in the human body?
Yeah. So, I mean, peptides are pretty easy to explain. I call them messengers or sometimes light switches. They're really just little pokes in the body. So they're small chains of amino acids, which are the building blocks of protein. So if we think about proteins as being these long, like long chains, peptides are tiny ones, just tiny little chunks of the peptide. And they're messengers. They literally just tell the body what to do. So they don't really replace anything. They don't put anything back. They really just force the body to do stuff. And they remind it how to function optimally. So in my patient population, I usually liken it to a light switch. You're either turning on something, turning off something, or maybe the dimmer, you're nudging it. And that's really how they work. Pretty simple, pretty straightforward.
Yeah.
Not replacement, though.
I love that. Yeah. And I think that's what a lot of people are worried about, because they think about, like, oh my God, if I take these, do I have to take them the rest of my life? Right. But it's not that, as you're saying, they replicate natural signaling, like to stimulate or to dampen, like you'd said. So why are peptides all of a sudden everywhere? Like, what caused this big sort of explosion of, this concept of peptides?
Yeah. I think, like most things in life in general, I think social media just made it explode, to be honest. When things work or when people feel better, it tends to make it to public knowledge, social media in our case these days. So I honestly think that is the main reason that it's finally blown up. I mean, they've been around for a really long time, right? The Russians made them during the Cold War, and we knew they worked for a long time. It's just manufacturing them and getting them to the mainstream population has always been an issue, because they're not technically patentable, right? You can't put a label on these and sell them usually with pharma. So they're helping people, they're feeling better, they're leaning out. So the hype is there, obviously, but the science is actually real. Like, I feel like the hype just brought it to the forefront.
So you're saying you don't think this is like a fad or a trend. You're saying this is genuinely like the future of healthcare. Oh,
it's 100% the future of healthcare. There's no doubt in my mind that these peptides and what they're able to accomplish by literally turning things on and off. I mean, that's what we all strive to do with our genetics, right? We want to turn things on and off.
Right.
So yeah, I don't think it's a fad.
Yeah. So you touched on something about, like, manufacturing and all that, the difficulties of getting that to the mainstream. So maybe touch on, like, why aren't people hearing this from their general practitioner or primary care physician? Like, is it lack of education or like lack of insurance driven, like, awareness of this? What is it?
Probably all of the above.
Yeah.
In reality, and I was a primary care physician, so I feel like I can speak pretty freely about the constraints put on you in your PCP world. And you have a certain number of minutes to see a patient. You are very limited by the information you're allowed to provide, right? Because, you can't provide information that might not be FDA approved, and that might not be on the guidelines of what you do, according to your family practice board, if you will, for fear of being shut down, really. So, that is, I think, the primary reason. I think at this point, a lot of providers know about it. They just don't have the education, which is why I teach a lot of it. And they don't have the time to go into it with patients, nor do they really get reimbursed. Insurance companies are not going to pay you for your time about talking with a peptide. So that's the unfortunate part about insurance-driven healthcare. And maybe also the litigation system in our country, and how really it's not really about what's best for the patient all the time. It's what's making the most money and what falls within the box, right?
Follow the money.
Yeah. Yeah. That's going to be a big theme tonight, I think.
Yeah, I know. We don't have to get too deep into that.
No. That'll be a private conversation.
I know. Well, I'm curious to know, like, do you foresee in the future this being like standard of care, and peptides will be part of like routine medical practicing, or is this always going to be something you're going to have to seek outside of like your general practitioner's counsel?
So I actually fear the day that it becomes general medicine, to be honest,
Mm-hmm.
primarily because of the cost associated when it becomes a prescriptive and it becomes taken over by pharma. I think like most things, a lot of these will become mainstream. For example, GLP-1s, right? We know those brands of diet medications. And the problem when GLP-1s came out was the price was prohibitive and the dosing was extremely stringent, right? So you couldn't adjust dosing because people are afraid of giving patients control, really. So that's my fear, is that some of these they know they work and they will get put to the market, tested, FDA approved, and then put into a pharma. I do think it's coming. I don't think it's coming with all of them. There's so many and they are coming so rapidly. I don't think it will ever be all mainstream.
Sure.
And AI has come up with so many more. It's crazy. So I don't think that it will ever be completely mainstream. I think it's always going to be trying to get ahead of the curve, to be honest.
I've heard there are some clinical trials happening, if I'm not mistaken, with things like BPC 157, TB 500. Yeah. So yeah, I think.
And they're IRB sanctions. I mean, they're, official studies. So, writing's on the wall, right?
No doubt.
Yeah.
So I want to get into the exciting stuff, talking about like specific peptides and like some of your favorites and my favorites and ones that maybe you've experimented with and have a lot of clinical experience with, seeing patients. And, we talked beforehand about some categories. So maybe I'll introduce some categories one by one and we'll talk about, your favorite ones and, clinical applications and such. So let's talk about brain and cognitive health. I'm very interested in this. Being a chiropractor, a lot of people don't realize that a lot of the benefits of chiropractic aren't just musculoskeletal back and neck pain. There's actually a lot of really great benefits and research-backed benefits of chiropractic in optimizing the nervous system. So, brain and cognitive health is something that I, am fascinated by. So what I want to know is like, which peptides are improving cognition, focus, memory, and just like overall brain performance that you're seeing?
Yeah. So there's a few. And when we talk about cognition and maybe attention or regenerating nervous tissue, there's two that come to my mind most. And Sermorelin is one of them. Just like it sounds, like Sermorelin, you're basically repairing the brain. You're creating like a repair signal and you're supporting those neurons under stress. So a lot of our concussive patients or neurodegenerative, so like neurodegenerative diseases. So I'm sure you get a lot of those, Ryan. Age-related memory stuff. Yeah. I do really like Sermorelin for that. It also helps with mitochondria. So just the energies of the cell, just making sure it works well. The other one is dihexa, and dihexa, again, post-concussive is probably one of the biggest things that I use this for. So, I've actually used it in kids as well. But learning issues, memory issues, brain fog, your women that are menopausal, that just progesterone just isn't enough. I use dihexa with quite a bit. And the other two that I'll talk about really briefly is C-Max and Salank. I love to call them my double S's, but think about them like one for anxiety. So Salank is for anxiety and C-Max is for like energy and focus. So if you can just make them really, really simple, C-Max, again, great for that menopausal female that might have like brain fog or men, actually low T men, not getting that brain clarity that they need out of their testosterone. I really like C-Max. Attention, learning, ADHD, working memory. Salank, almost 100% anxiety, generalized anxiety, acute anxiety. You can use it in a pinch. Like you can use it if you're having an anxiety attack. It works pretty quickly. Wow. Or it can be taken preventatively. I use it for a lot of my women at night too, to help sleep, overactive brain.
Very cool.
So those four in really basic terms, I would think of two more like brain and recovery and the other two more like your anxiety and focus.
And how are these ones specifically, out of curiosity, how are these administered? Are they like oral, injectable, inhaled? How are they administered?
Yeah. So Salank and C-Max both come as an injectable. There used to be nose sprays out there, but unfortunately right now nose sprays are kind of off the table for the most part for Salank, which used to be a really good one, especially for acute anxiety. I'm hoping that comes back. The reason it's off the table is it really penetrates the blood-brain barrier, which is great.
Right.
But, right now it's not available to us. So the other two are mostly, Sermorelin is injectable, and the dihexa is usually capsule. So the nice thing about dihexa is it can be taken as a capsule. I have seen it as an injectable as well, but I actually do it as a combo capsule, most commonly.
Very
A little bit of everything. I know.
Yeah. And those are ones you don't hear about as much. I would say you're hearing about more of the I guess the healing peptides, the weight loss peptides, but these are interesting. What are your favorite ones? I think we're going to spend a little bit of time here because this one is extensive, but let's talk about fat loss first. Like what are some of your go-to fat loss peptides for patients?
Honestly, as a guinea pig, you probably know this even better than I do. Because it's like when you play around with them a little bit yourself, you kind of see what works better and what doesn't. I always say that there's orelins, right? ORELIN, because it's just the easiest way to explain them. And all the orelins are basically going to do one thing. They're going to stimulate growth hormone. And they all work a little bit differently. I would say they have nuances. And I think that's probably the hardest part of what we do in this part of the peptide world is figuring out which one of these works best for different people.
Yeah.
Correct me if I'm wrong, but
no, absolutely.
I know your exercise people, especially men, probably like Tesamorelin, Ipamorelin combo the best, right?
Yep. It works on both. So you're hitting on growth hormone releasing hormone peptides, which like you're saying is stimulating actual the precursor to growth hormone release. But then there's also the growth hormone releasing peptides, right? Which work on that hormone ghrelin, which is that hunger hormone. So it's a little interesting.
Well, and you just hit the nail on the head, right? Because when you hit the ghrelin, what happens? You get hungry.
Exactly.
Right.
So it may not be so good for people that want to lose weight. Yeah.
Yeah, women hate that. So I would say that's the nuance to this. It's your Tesamorelin. Really, it does a good job on visceral belly fat. It's a really nice job. And actually, I see a bigger improvement with metabolic health, like insulin resistance and things like that with Tesamorelin. Ipamorelin, I think, is a little gentler. It's that ghrelin receptor agonist, but it can make you a little hungry. So you get the kind of good with the bad. It has a very low side effect profile. And when I'm checking labs, I don't see as much cortisol raise on those people.
Oh, interesting.
Yeah. So, Ipamorelin tends to be a little bit chiller. And Sermorelin, I would say, is a little older school, but it has what they say is it has a more natural pulsatile growth hormone release. So it actually increases natural pulsing of your growth hormone as opposed to, and actually that can make you pretty hungry too. I have seen that make people pretty hungry.
Have you found that? So I've found that people that are taking Sermorelin, I find, have the biggest sleep benefits because the direction is typically, an hour before bed or so. I find the Sermorelin people get way better sleep than any of the other ones. I don't know about your experience.
No, 100%. I think Sermorelin does a better job with sleep. I think it's due to the natural pulsatile nature of it. And if I have them take it at night, they'll get that nice growth hormone pulse, which helps them to sleep and has that cortisol regulation. So yeah, I would agree with that. And I used a lot of Sermorelin, obviously, when Ipamorelin and Tesamorelin weren't available to us. So I had a lot more experience with that for a while. I think for women specifically, though, they didn't do as well as my men, which I thought was interesting.
That is interesting. Yeah.
Yeah. So they just didn't notice the difference in the leaning out that they wanted.
Right.
Whereas Ipamorelin, Tesamorelin, they're getting that effect.
I've seen that too. Yeah.
Yeah. It has much higher side effect profile. So when you're talking about someone that maybe doesn't have a lot of insulin resistance, but they're perimenopausal, they're andropausal, they're hormonally challenged, and that their sugars are going up at inappropriate times because they have to be because they're gaining weight in belly areas, I tend to lean more towards the tirzepatide. If they have high sugars and their insulin is high and I think they can tolerate dropping those sugars, I'll use semaglutide. So I actually will look at it two ways, whether or not they have gut issues to begin with. I'm usually trying to stay away from the semaglutide. Accent on whatever syllable you want.
Yeah, that makes perfect sense. I
try to distinguish between that because really they both do a great job. It's just someone that's low blood pressure, maybe older, I'll stay with the tirzepatide because I know that they're not going to tolerate the semaglutide.
Right.
Yeah.
And not to get too far in the weeds about those, but as far as like your expectation of someone who's going to do a 90-day trial of, let's say, just tirzepatide, for example, what's the expected weight loss there? And how are you managing and minimizing any of the so-called side effects that people are talking about? Like, what's the reality of what they should be concerned about?
Okay, let's take that. Well, I'm a really slow starter with my GLPs. So meaning I don't double every week. So I tell them first 6 weeks, 4 to 6 weeks, you might not expect to lose much. Like you might lose the first couple of weeks, like just because of water loss and eating less, but don't expect huge losses in the beginning. Because I'm a big believer in getting them used to it.
Yeah.
Because once you get used to the drug, then you can advance it. And really you have a lower minimum dose that you need to lose weight. So where you're doubling it every week or every 2 weeks, yes, you get used to it, but now your maximum concentration for effective weight loss is very high. I like to keep it as low as possible. So, that's my thing. So I wouldn't say more than 2 or 3 pounds every couple of weeks.
Yeah.
2 weeks or so. I think that's reasonable. If you're more than that, they're not eating. And that's part of what we teach is that you have to eat. And I'll actually decrease their dose if I find out they're not eating, really.
Right.
Like if I see weight, I'm a pretty big stickler with that. We won't refill it early, that kind of thing. Managing symptoms, gut stuff, diarrhea is really just making sure they don't eat a lot of fatty foods or large meals. That's the biggest thing with that because the gallbladder and the liver, primarily the gallbladder, just doesn't like it. So, or pancreas rather, and gallbladder don't like it. So when you're doing that, it actually wants to try to break it down real quickly, and then your stomach just dumps it, right? So it just doesn't like it. The constipation part of it, there's a couple things. Spreading out the dose really helps. So more than 7 days, 10 days, 2 weeks. Lowering the dose really helps. Obviously water, lots and lots of water. Every once in a while, we'll have to use something like a stool softener or, prescriptive. But for the most part, if they're low enough dose and they start slow enough, we'll do a gut protocol. So we'll do like a digestive enzyme, calming gut powder to try to get it to go through. Yeah. And then sugar, like honestly, sugar, if they're bottoming out, it's because they're not used to hypoglycemia. And I have them put a little fruit juice in their water, hard candy in the side of the mouth, things like that, just the first couple of weeks to try to get them through it. Because that's usually, it's like going keto or not eating carbs the first 6 weeks. It's the same thing.
Yeah. So it sounds like you're starting really conservative, almost like the microdose approach.
100%.
Yeah. With people, which I love that. So, and also making sure that you're, pounding into them that you got to get enough protein in. And I'm sure you're a big stickler on making sure they're lifting weights, right? And keeping
very much.
Yeah.
Right.
Yeah.
And they meet very strict FDA guidelines, sterility, quality standards. So that's really important. You're buying sterile compounds from and I don't know if anyone remembers the early 2000s, but that's where all the compounding regulations started because sterile compounds were coming up dirty and giving people meningitis. So, for me, I would say, cautionary tale, you don't want to be that person that ends up with a dirty batch. Forget the quality of it, right? It might just be trash, but it can be non-sterile. They should all have documentation. They should have certificates of authenticity, batch lot numbers. I mean, if you ask the companies that we get them from, they can give you a COA on any single lot number that you buy. And they should all be reconstituted with sterile water. I've seen people doing it with not sterile water.
Tap water?
Yeah, not tap water necessarily, but yeah, like this is big no-nos. I've seen people do it with normal saline, actually,
really
accidentally, which isn't going to hurt you. But again, you're not doing it with a provider, so you should really know that normal saline is just going to denature some of the proteins, not all of them. Some of them will be okay, but the oralins don't like it, so you're going to denature them. They're going to turn into a gel, and then you're injecting something that's going to make you hurt and itch and everything else. So I think that that's really two of the biggest things: is purity, potency, all the additives, a lot of these companies are adding things to make them dissolve better. I think that's really the biggest thing we can take away. When these 3 kids came into my office, which I don't treat a lot of children, so it was a really kind of eye-opening thing. Social media is making this like a very, very big deal, which I'm obviously appreciative of because it actually helps business, right? But it needs to be safe. It needs to be legitimized, regulated appropriately. But I mean, they move the needle for people. I mean, they definitely make a difference, and it's a long-term difference. Like you have to, this is a game of, this isn't a quick fix. This is a game of like 3 months plus, right? Like you have to stay on them for a little while. I think that's the only thing we really didn't talk about is longevity. Like you really do have to give them time to work.
I love that.
So, yeah.
Amen. Yeah, I totally agree. Yeah, I think they're not like the easy button quick fix. They, I like to tell people that if they're not willing to put in the work as far as making lifestyle shifts to that align with their goals, whether it's fat loss, whether it's with muscle building, improving their immune function, if they're not willing to change their behavior and also add peptides, then they're just going to waste their money because these are called optimizers for a reason. Is you can't optimize bad physiology.
You can't optimize eating trash.
Yeah, you can't optimize yourself if you eat like a trash panda, as Lily would say. So,
oh yes, very true.
So yeah, I mean, that's why this works so well with people that are wanting to put in the work, the effort, spend the time, energy, and money, into getting results. So Dr. Lori Gerber, thank you so much for joining us tonight and donating a generous hour and 15 minutes of your time. I know a lot of people will get a lot of benefit from this, and everybody will get a recording from this webinar as well as an email with all the generous offers. So
awesome.
I appreciate
Thank you for balloons too, guys. I appreciate it.
Oh yeah.
Awesome. Balloons made my night.
Love it. Thanks, Lori. Talk soon.
You're welcome. Thank you.